All right, welcome to this session. We are going to look at health systems, and this is our first lecture. I hope you can hear me loud and clear. Yes, Joseph?
Yeah, I'm getting you.
All right, great. I just wanted to confirm that you're on. Yeah, so in this session, we are going to look at the definition of, just a minute here, the definition of health systems and what it encompasses. Okay, so we'll also look at the fact that the health system has components which are interconnected. So we shall look at how the interconnections work. And then we'll look at the role of health systems in public health, and then also describe the building block framework or model of health systems by WHO. So those are our objectives. So when we talk about the health system, we need to first understand what a system is. A system is made up of components or parts that are interconnected and that allows the different interconnected components to function as a mechanism or as a unit. Okay, so therefore, when we talk about health systems, we refer to all the institutions and activities that are aimed at promoting, restoring, and maintaining health. That is how WHO defines health systems. So, like I said, we have organizations, institutions, professionals, resources, and the policies, all with one aim of delivering healthcare services to communities and individuals. Therefore, you need to have a very robust and resilient health system in order to provide coordinated healthcare services that are well managed and delivered to everyone within a given community. So therefore, we have the different companies that allow the connection of patients, providers, and other key stakeholders with that sole goal of ensuring that the citizens or the members of a given community are able to receive healthcare services. So this is how you can look at it, is that in whatever community that you're staying in, you need to have access to food, you need to be in a safe environment, your children or you yourself should have access to education, and you're staying in a well supporting family and social network. Okay, and you also have a very strong, resourceful community. These issues that I've talked about, access to food, environment, education, and the strong family and a cohesive community are very important in influencing the level of health that you will have. What do we call the determinants of health? Now, if you get sick, you will go to the health care facility, which is basically a building. There should be a building that is well equipped with the equipment, medicine, and the health providers. And then they should give you the services that you need. That means that they should diagnose you, and then they should give you the medicines that you want. They should give you the medicines that you want. That means that in the process of making sure that they diagnose the condition that you are having, they run tests. Okay, they run tests, they do examinations, and then they find out that you're suffering from a disease X, and then they get the medicines, that is the pharma that you see there. And then now it depends on who pays for the services that you have received at the health facility. It is either the government or it is you to pay for the services. So the whole network that you have seen that has the government, the payers, the patient, the health providers, the services, the equipment or the devices, and then the drugs, that whole system is what we call the health system. So the health system has a primary goal of ensuring that everyone has access to quality healthcare services. But what is very key is that when someone falls sick, they should not um, they should not reach to an extent of being poor because they have been sick. So the health system should protect against what we call financial catastrophe, or what we call catastrophic expenditure. Okay, which is that the health system should provide financial protection against the cost of ill health, and ensuring that no one becomes poor because they have fallen sick. Okay, so that is the one of the major objectives of the health system, that people should be able to get the services that they need, and that the services should not be those that will make them poor because they cannot afford. Okay, and then the health system should be able to meet people's expectations, considering issues to do with technology, waiting time, and respect for individuals. So those are the objectives of healthcare systems in accordance to the World Health Organization. So like we saw in this diagram, we have the government, and then we have the patient, okay, or the patients, or the clients, and then you have the health providers, and then we have the equipment, and then we have the services, okay, and then you have those who pay for the services, and then you have the pharmaceuticals. These are basically the components of the healthcare system. So when we talk about the components of the healthcare system, we talk about the infrastructure, which are basically the buildings, is it the hospitals, the primary healthcare units, the primary healthcare centers, the nursing homes, the private health clinics, or even the government health clinics, the technologies and equipment used. These all fall under what we call health infrastructure. And then the other component are the health professionals, which include the nurses, the doctors, the allied health professionals, and then also health administrators. And then we have what we call the pharmaceutical industry, where the drugs and other supplies come from. And then the financing mechanism, health financing, where does the money come from? Is it the government, or is it the individual people paying for the services? And then you have the health information systems. How is data captured? Health data. How is it captured, stored, managed? How is it actually used? Okay, and then you have the governance and leadership. Who makes the decisions on which health services should be provided? Who provides direction? That is the component of governance and leadership. So that the components that we have looked at have been simplified by WHO, and what we call the building blocks model of health system was now put in place by WHO basically to give us an understanding of how the health system is supposed to be. Okay, if you want to understand the health system of any country, what are the things that you have to look at? So, what are the building blocks? So, you look at service delivery. That means you're looking at how the services are delivered. That is, who delivers the services and where. And then the workforce, the people in the health sector, the health workers. And then the information which we have looked at, we said information about health should be captured for surveillance purposes and also for planning purposes. That's very important. So health information systems need to be there. The pharmaceuticals or the pharmaceutical industry is that which provides us with the medical products, vaccines, and technologies. So we have that building block, and then we have the financing, and then leadership and governance. So we have 6 blocks. Overall, is that these different blocks should work, or they are not in isolation. They they are interconnected to make sure that people get services that they need. So that means that there should be accessibility, okay, and most people should be covered, and that the services should be of good quality, and also they are safe. When you have that, it means that you're going to improve healthcare or population health at the different levels. And that means, therefore, that you will be able to make sure that you don't have people who are not getting the services that they should be getting. And then the other issue is responsiveness, which is that the services should be those that are needed by the population. And then the next one, which is social and financial risk protection, which is that uh, when people get sick, they should not be spending a lot of money that makes them to become poor. Okay, so you protect them against financial risk. And then that you should not be overusing resources. We should minimize wastage of resources such that you have improved the efficiency. So that is the building blocks framework or model by WHO that helps us to understand how a given health system works, or if we want to analyze any given health system of any country, we can use it to be able to describe that health system. So this is the same aspect, that leadership and governance is at the center of making sure that you have a well-functioning health system. So we are going to look at each of the blocks and explain them in detail. So we start with the service block. These are the healthcare services that are provided to the individuals and communities. They can be provided at the community level, okay, where we have primary healthcare workers, or we can also have community health workers, okay, and then it can also be provided at secondary level. This is where we have now the hospitals, like for example, in our context, the state hospitals provide secondary care, and then the tertiary care is provided at the national referral hospital. Okay, across the different levels of healthcare, you can have varying extents of services, preventive, curative, and rehabilitative. Usually, rehabilitative services are done at higher levels of care. Okay, so at each level, we are talking about different infrastructure, professionals, and also health programs that are being implemented. When we come to the workforce, we are talking about the health workers who are delivering the health services. This include the doctors, the nurses, and other allied health professionals like the clinic officers, the radiographers, the laboratory technicians, the theater attendants, and also the community health workers. You can also look at the health workforce depending on the level of their training. You can have specialists, and then you can have general practitioners and other health professionals with their different qualifications. When we talk about the health information system, we are talking about data, how health data is collected, analyzed, and disseminated. Health data is very important. We need to use it for decision making, to know which community requires a lot of attention, which interventions can we implement to address the health problems happening in different communities. So we need to understand the levels, the health status of communities, and then be able to act and see whether our interventions are actually bringing the results that we want. Okay, so we need data for many reasons, like I've just said. And then the aspect of access to medicines and relevant technologies. The medicines, of course, include the drugs that you take, the vaccines that you need, and also you need the relevant diagnostic technologies to be able to know which conditions you have. What is very important is that the medicines should be accessible and available to you, and they should be used rationally. That means that they should be used for the purpose that they are intended for, and then they should not be costly. And then financing is another block that we talk about, that for you to receive healthcare services, you need to you need to make payments. Often the payment can be made by the government, or you make the payment yourself, or it is the insurance company. If you're insured, if you insured yourself, or if your employer insured you, then means that they are the ones to make the payment. What is very important is that we don't want you to lose a lot of money because of paying for health bills. So we want to avoid as much as possible what we call out-of-pocket expenditures or out-of-pocket payments. And then the last block, which is leadership and governance. This is we need to look at this at the level of decision makers, policy makers, those who provide direction and guide the health system. Okay, so this can happen at the national level, where you have the National Ministry of Health. Then at also the state level, you have the State Ministry of Health, the county health departments, and the other community infrastructure or governance structures. So we need to have robust governance systems that are accountable, that provide leadership in making sure that the population of the community is protected, promoted, and diseases are prevented. So that what we have looked at are the blocks of the health system as proposed by the building blocks model of WHO. But another way we can look at the health system is what we call the structure process outcome model. This is very important, especially if you want to analyze the health system quality or healthcare quality, where you look at the three components of structure, process, and the outcome. So for you to look at the performance of the health system, you may start by looking at the three components that I've just mentioned: the process, I mean, the structure, which is the first one, that this looks at the infrastructure that we talked about earlier on, the facilities, the physical facilities, that is the buildings of the different health facilities, the hospitals, the equipment that are actually being used. We also put human resources under infrastructure, and also organizational attributes and financial arrangements. These are also included in structure, under the structure process outcome model. And then we look at the process. How are the services now delivered? The actual activities of delivering the services, the interactions, okay, the sequence. If you go to a health facility, what processes will you follow to get the medical services or healthcare services? Okay, so we look at your interaction throughout the diagnosis, the treatment, and also the coordination of care. Okay, and then we look at the last component, which is the outcome. Okay, when you go to a healthcare facility, the expectation is that you get improved health. If you had an illness, the illness is identified and treated, and then your health is improved. And then that means that these services should be able to improve your quality of life, reduce morbidity. Okay, so if you want to look at how a given health system is performing, we can look at the overall health status, the morbidity, and the quality of life. Okay, that's when we can know the health system performance. So that is the other framework that I thought it is very important for you to really look at. The other aspects of a health system are quality, access, and efficiency. Okay, quality is that the services should be of high quality. This looks at different aspects. Technical quality, you can say clinical quality, we can look at basically, you can also use the term service quality. But the, the key aspect here is that, all right, so every individual in a given community is supposed to be receiving quality healthcare services. And this is a broad topic, but the key things are that the services should be safe, effective, and that the issues to do with making sure that you use the right technologies, how you interact with the patients, the waiting time, or whatever it is that you can think about that can influence quality is very, very paramount. And then we move to the next one, which is access, which is that people should be able to utilize healthcare services when they need them. Okay, that means that the services should be available, and they should not cost a lot of money. They should not be costly. They should be affordable, and that means also that the services should be provided in a timely manner. And then efficiency, which is that you want to produce better results, or you want to have good health outcomes without wasting a lot of resources. So you need to produce health services and goods at a minimal cost. Okay, that is what we call efficiency. But you can also achieve efficiency through what we call allocative efficiency, which is that you basically need to provide the services that can bring you the results that you want. Okay, that is allocative efficiency. So, like I earlier on said, that the health system is interconnected. This is to say that the different components do not work in isolation. Okay, the different components do not work in isolation. For example, you can see that leadership leadership determines the amount of resources that can be allocated to health, and also determines the nature of health services that are being provided. And the nature of health services that are being provided now determines the health outcomes. And these are related to the health system goal. But everything does not happen in vacuum. There is a context to it. Okay, there is a political context, there is a social context, there is an economic context. So the nature of the health system is determined by all those factors in the different contexts, and that will arise, that will actually influence the nature of the health system that you have in any given country. So, like we said, the healthcare services are provided at different levels: primary, secondary, and tertiary. We also have what we call quaternary care. Okay, issues like some cosmetic surgeries are classified under a quaternary level of care. So I will basically look briefly at the history of the health system, the practice or the nature of the health sector that we have today is not what used to exist many years ago. Okay, but what we have witnessed is that there has been an evolution from traditional medicine and home-based remedies to now having modern facilities that can be able to identify illnesses that you have and be able to treat them. Okay, so along the years, with different discoveries and issues to do with regulation, this is what has resulted into professionalization and also specializations in different fields in the health sector. Okay, but of course, as the health system evolves, it comes with a number of challenges that also requires that the health system keeps on changing. Okay, so in the 21st century, we had issues to do with increasing need for chronic care because of increase in chronic conditions and also having aging populations and also the need to appropriately use technology. This also creates another problem of increasing the cost of care. But of course, we are moving to a direction of shifting the nature of healthcare that is being provided to the population. But in the 20th century, the interest was about moving healthcare to the community. Okay, So as we speak now, the focus is on ensuring that we use technology appropriately, and we are having a lot of digital technologies in health. We are applying a lot of artificial intelligence, machine learning, all these technologies in health. This is what is being carried out. There is a lot of interest in research that focuses on population health, ensuring that we have a lot of investment in preventive medicine, okay, and in improving population health. But we are also focusing on tailoring treatments according to one's genetic makeup, what we are referring to as genetic personalized medicine. So a lot of things are happening currently in the field of healthcare. Okay, now let's look at what we call systems thinking. Um, Having looked at the different components of the health system, in order for you to analyze and see how the different components interact, you need to apply what we call the systems thinking in healthcare. This allows you to have a holistic way of looking at problems in the health sector. And therefore, when you make decisions, you are in position to understand what implication will it have on different components. So that's what we call systems thinking. And we need to understand the key stakeholders in healthcare systems. We have the patients, the health providers, the insurers and the payers, government, pharmaceuticals, and many other people. They play a very significant role in the health system. Okay, what are the challenges that we are facing in the health system or healthcare systems? We have one challenge of increasing costs. Okay, people are not in position to pay for their own healthcare. The governments are not also allocating enough resources for healthcare. And then you also have uh, communities that are not having access to healthcare services because of their income or even geographical location and other factors. So we have disparities happening. We also have an increasing aging population. Okay, these require what we call long-term care because they often have chronic conditions. And then we move to another point where we have limited access to essential medicines. We have, especially in developing countries, we have limited access to essential drugs. And then issues of people becoming poor because they have become they are ill, what we call health-related impoverishment. And then we move to healthcare shortages. Okay, we have a shortage of healthcare workers, and we don't have a robust system to store and manage our data systems. And for example, we have inadequate death registration systems. Medical equipment are in limited supply, and in some cases, when they are available, they're not being utilized very well. Okay, and then you have people who have resources don't use public healthcare services, and this often means that public healthcare services are not improved. Okay, they are of poor quality, and therefore the rich cannot use them This is not something that we would want. And then the nature of the health system is that there is a lot of focus on providing curative care instead of providing preventive care. So one of the challenges that is facing the healthcare system. And then we have an issue of human resources, which we said that we have limited human resource. So what do we need to do about it? Enhance training. Okay, we need to enhance training, invest in human resources for health. Okay, and then be able to provide health workers to areas of need. That's very important. Improve access to essential medicines by having proper supply chain management practices, and also ensuring that there is availability and also the drugs or the medicines are affordable. Overall, you basically need to strengthen the pharmaceutical systems. And then you have people who are not having access to healthcare services because of either income or geographical location. It is very important that you identify these populations and be able to tackle the problems that they actually face. And then have a robust health information system that will enable the health system to be able to collect data and be able to use it appropriately. Build enough physical health facilities and ensure that they are equipped with the needed medical equipment and technology. And then have a financing mechanism that is actually equitable and sustainable. Okay, that will be able to protect citizens against financial loss. And then ensure that you have private public partnerships to address the challenges in the health sector. And then have governance systems that are responsive, accountable, and transparent in order to deal with the health challenges. Have a health system that is resilient, that can be able to absorb any global health crisis, for example, pandemics and emergencies. Thank you very much for listening. If you have any questions, please you can ask.